Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video on hidden secret number 2 of why you can still have back pain. In this video, in hidden secret number 2, we're going to talk about multifidus problems, injuries to the multifidus. The multifidus is a group of muscles that are very deep in the back. The back has hundreds of muscles, and they are organized in layers, and there are actually 5 layers of muscles in the back, and the most inner layer that involves these very small, tiny little muscles, one of which are the multifidus. And the multifidus muscles are largely stabilization muscles. They don't have a lot of strength, and you don't really recruit them to lift heavy objects, but they are there for stabilizing the spine. And what happens is if they get injured, it is largely a neurological problem. And when these little muscles get injured, the nervous system doesn't send a sufficient amount of impulse through the motor division of the nervous system to the multifidus muscle. And when the multifidus no longer receives an ample amount of signal from the nervous system, it starts to atrophy or shrink and get very weak. Now when that happens, then the other muscles of the spine try to compensate for the lack of stabilization. And the big muscles, the big power muscles of your spine on the outer layer, they tend to overfire, causing them to become spastic, and they start to splint. And you lose stabilization and strength in your muscles and in your back as a result of this. So the medical approach when people have back pain, from my experience, is that they will typically take an over-the-counter medicine, or they'll go to their medical doctor and they'll prescribe some kind of a muscle relaxer, or they'll give them an anti-inflammatory agent, or in some cases even some kind of a narcotic to numb the pain. None of those approaches are going to fix this problem. This is a neurological issue, and it has to be addressed neurologically. And so in my office, the way that we correct this problem in helping the multifidus muscles is, number one, through the use of chiropractic adjustments to realign the vertebrae and take the pressure off of the nerves. In between the vertebrae are the spinal nerves that come out, and they branch off of the spinal cord. And if you have a misalignment of your vertebrae, that's going to cause pressure on the nerve, pinching the nerve, causing the multifidus it'll shut down the nervous impulse to the multifidus muscle, causing them to shrink and causing the other muscles to become overactive and to become spastic. So the first component of this is to restore motion and alignment to the spine. The second component of this equation is to prescribe specific exercises, first to stabilize the spine, and then second to restore strength to the spine so that you are having all the muscles firing as they were intended to, and they're back to their normal strength. Well, I hope you enjoyed this video, and I hope you learned something. If you have any questions about back pain or the multifidus muscle group, please feel free to communicate with me. I can be reached through my website at redapplewellness.net. Please subscribe to my YouTube channel, and please tell a friend. And thank you very much for checking out this video.